Today, we are going to be discussing situational mutism and providing information and resources that you as teachers can use to best support your students. My hope is that you leave today's presentation feeling confident that you understand the signs and underlying cause of situational mutism, as well as the proper next steps that you can take to effectively help children with this disorder. Based on the diagnostic criteria provided by the DSM-5, situational mutism, or SM for short, is an anxiety-based disorder, causing a consistent failure to speak in specific social situations despite speaking effectively in other situations. It is a disturbance that interferes with the child's education and/or social communication. The duration must be at least 1 month, but is not limited to the first month of school. This is because many children, especially those who are shy, anxious, or adjusting to a new environment, may speak very little during the first month of school. This is considered a normal adjustment reaction, not a clinical disorder. The DSM wants to avoid misdiagnosing SM based on temporary situational anxiety that often resolves as the child becomes more comfortable. It is also important to note that the failure to speak should not be attributable to a lack of comfortability or knowledge of the spoken language. For example, children who are learning English as an additional language or an EAL learner, or be better explained by a communication disorder, such as a voice or fluency disorder. The terminology used to describe this disorder has changed over time. There has been a recent development to update the label from selective mutism to situational mutism, because selective implies that the child is selecting to not speak. As expressed by the Selective Mutism Information and Research Association, selective is a medical term, which means some of the time in some situations, as opposed to pervasive, which means all of the time in all situations. This is a different use of the root word select and does not imply selecting meaning to make a choice. It is important to understand that children with SM are not choosing not to speak. It is based in anxiety and not defiance. Before the term selective was used, the label of elective mutism was used in previous DSM publications, which, as you can imagine, came along with similar misinterpretations of the disorder's origins. So moving forward, we are going to be using the term situational mutism, or again, SM for short, because this most accurately describes this disorder. So now we're going to talk about the signs of situational mutism. So it typically emerges in early childhood. According to one study, the average age of onset was between 2.7 and 4.1 years. However, SM usually becomes evident when the child begins school because they are now being asked to interact with individuals outside of their family. So as discussed, the primary sign will be a child's inability to speak in certain situations, in this case at school, despite speaking in other situations, for example, in their home. Some children will be completely unable to speak, while others may communicate less or in more limited ways. So let's talk about some of the signs that we might expect to see across this spectrum. The child may freeze or have a stiff posture, carry a blank expression, avoid eye contact and participation in social interactions. They may avoid asking for things that they want or need, which can lead to toilet accidents or even malnutrition. They may throw a tantrum or act out behaviorally because they are unable to express themselves. The child may use widely recognized sounds such as uh-huh for yes or uh-uh for no. They may use facial expressions, nodding and pointing to share their ideas. For children who are less severe, they may respond very slowly or use one word or short sentences. When they do speak, it may be quite quiet or mumbly, or they may even change their voice to produce a robot-like sound with an unnatural pitch and tone. Every child is different, but these are some common signs to watch out for if you are suspecting situational mutism. We are now going to complete a quick activity to demonstrate the child's perspective of speaking events in SM. So in this activity, I would like you to put up your hand if you've ever felt nervous or anxious in any of the following situations. Put up your hand if you've ever felt nervous before giving a presentation. Put up your hand if you've ever felt nervous when you've been called upon unexpectedly in class or in a meeting. Has anyone ever felt nervous introducing themselves to a new group of people? What about before a job interview? I imagine that all of us have experienced anxiety in similar high-pressure speaking situations. Our heart rate may rise or we may stutter from the nerves. For children, not speaking is their way of escaping these high-stress situations, and avoiding them can be highly reinforcing. Hopefully, this exercise helps to highlight how anxiety plays a role in this disorder. So there's not one underlying cause of situational mutism, and it is not a preventable disorder. It is actually believed to arise from an interplay of multiple factors, which we will now discuss individually. There appears to be a genetic component, as many children with SM have a family history of anxiety disorders, specifically social anxiety. Dreisen and his colleagues conducted a meta-analysis which looked at 837 children, and their research found that 80% of children with SM were also diagnosed with an additional anxiety disorder, 69% of which was a social phobia. Environmental factors may include limited opportunities to interact socially, for example, a worldwide pandemic. So although there is not empirical evidence, many professionals working with children have reported a rise in SM referrals since the pandemic. For example, Elizabeth Woodcock, a clinical psychologist and the director of the Selective Mutism Clinic in Sydney, stated that there has definitely been a rise in cases since the pandemic, along with all mental health issues. High-pressure speaking situations, such as being put on the spot, may further contribute to feelings of anxiety, along with events of bullying or social comparison. Situational mutism will not be caused by a single traumatic event, but it is notable that trauma may trigger symptoms in a predisposed child. Environmentally, there may also be accidental reinforcement. So say, for example, the parent often speaks for the child for efficiency's sake, or a peer continually accepts nonverbal communication as effective. These events can unintentionally reinforce SM behaviors. Temperament also plays a role, as children who are naturally more shy or sensitive to noise in crowds are at higher risk for developing SM. Behavioral inhibition, or a biologically based tendency to react to unfamiliar people, environments, or situations with fear or withdrawal, is the most consistently linked temperament trait in situational mutism research. If a child has a speech and language disorder, such as an articulation, fluency, or expressive language disorder, this may lead to a fear of being judged and a hesitancy to speak. So this alone, again, is not likely to cause situational mutism, but it could absolutely be a contributing factor. As previously mentioned, we need to be sure that we don't misdiagnose a non-speaking child who is simply learning English as an additional language. So bilingual children may not yet have a comfortability with English, which can contribute to an apprehension around speaking it. This can lead to a heightened anxiety in situations where speaking English is expected, such as at school. Research has shown that bilinguals are at higher risk for developing SM. However, bilingualism alone would not be the cause. Imagine that you were on a business trip in another country where nobody spoke English. You probably would not be able to keep up or contribute to the conversation right away, but over time you would feel more comfortable. So it is important to mention what is known as the silent period, which is a common and normal developmental phase that many children go through when they're learning a new language at school, and they do not speak this new language right away. This period can actually last up to 6 months, typically beginning when the child realizes that their home language is not being understood. When acquiring a new language, receptive knowledge or a child's understanding of language will come before their expressive language. So that is why the signs must be consistent over a sufficient period of time for a diagnosis of SM to be justified. There are other ways of differentiating a bilingual child in the silent period from a child with situational mutism. So children with SM will typically be non-speaking in all languages and across settings, whereas those in the silent period will speak in their home language just fine and will only be non-speaking in 1 or 2 settings, typically wherever their non-primary language is being used. It is also worth mentioning that reducing the number of languages for the child will not resolve situational mutism, and especially with so many evidence-based benefits of bilingualism, we would never advise a caretaker to reduce the use of their home language as a solution. So now that we all know what SM is, let's talk about who will be involved in the support team. So children with selective mutism or situational mutism will have a multidisciplinary care team that will work together. So as you may have guessed, speech-language pathologists will be involved, and our role is to conduct a comprehensive assessment, including gathering a case history, performing an oral motor exam to ensure that the child's inability to speak is not being affected by structural or functional differences in their speech system. We'll conduct a hearing screening to rule out hearing loss as a potential cause, and an evaluation of the speech and language abilities of the child across settings, which will likely require videos from home and parental reports. SLPs will also make referrals to other professionals, such as psychologists, for further assessment and for diagnosis. Since SM is an anxiety disorder, psychologists will play a large role in the diagnosis and treatment of situational mutism. Psychologists will perform their own comprehensive assessment involving interviewing, questionnaires, observations, and standardized assessment tools. And based on this assessment, they will then provide their diagnosis of situational mutism and potentially other psychological conditions, such as social anxiety disorder. Psychologists will provide treatment to best address the child's needs, and they will also collaborate with other members of the care team to provide resources and strategies that will support the child. As teachers, you may be the first to observe behaviors of situational mutism, and parents likely will not be aware of the problem if the child is speaking effectively at home. So your role will be to communicate with the parents or caregivers about the child's communication in other settings. Document your observations and collaborate with the child's parents, SLPs, and psychologists to update them on the child's progress in the classroom and speak to challenges or successes within the school setting. You will also aim to implement supportive strategies in the classroom and with the child, and we're going to discuss that a little bit later on when we're talking about treatment. Parents will be able to share information about the child's communication and observations of the child's anxiety from the home and other settings, which will help inform the comprehensive assessments. They will also be recruited to implement supportive strategies. They will likely be involved in therapeutic tasks as a comfortable adult and given homework or home practice to work on with the child to expand the usefulness of therapy. Caregivers will be an advocate for the child. Of course, all of the members of the support team will take on this role. However, parents will have most access to the child's environment when they are not at school. So when they are provided with the right information and strategies, they will be able to advocate for their child across settings. Observation tracking can be extremely important, and it can help inform comprehensive assessments and monitor changes over time. As a part of the child support team and a consistent adult in the child's life, you will have the ability to help identify certain settings or situations that trigger worsened symptoms or facilitate success over time. This will help the support team track whether goals are being met and whether generalization or carryover of skills from therapy is occurring in the classroom setting. So here's one example of a tracking sheet that you could use as a teacher in your classroom to document your observations. The focus of these observations is simply to note patterns, not put pressure on the child to speak. So track and share successes, even the small ones. Now, there are many functional impacts for children with situational mutism. Academic success may be jeopardized as they will not be able to ask questions or participate fully in educational activities. Children with SM are likely less independent and may experience emotional frustration or low self-esteem. They will have a harder time engaging with their peers and making friends, which can, of course, affect their social development. A child may not be able to get their basic needs met. For example, if they need help opening their container for lunch or they need to go to the bathroom, they are going to have a much harder time expressing these needs. These are just some of the negative ways children with SM can be impacted in their day-to-day lives. It is important to look at how each individual child is being affected when we are assessing and treating situational mutism so that we can provide the best client-centered care. So next, I would like you to find a pair or a small group to try out this activity. I would like you all to try expressing these 3 different sentences without speaking. You may have noticed that facial expressions, gestures, or pointing were helpful. As adults, it may be easy to use writing as a substitute for speech, but for young children still learning to read and write, this will likely not be an option. You may have noticed that you became frustrated, or that your communication partner lost patience for listening to your message. Think of how quickly young children lose interest and the impact that this will have on a child's social engagement. It is important for us to understand how difficult it can be to express yourself when you're unable to speak, to better understand what the child is experiencing. Situational mutism is treatable with the right support. Early identification is key to rule out other communication concerns and begin treatment before the functional impacts become entrenched, leading to a higher resistance to change. The intervention for SM is behavioral therapy, primarily conducted by a psychologist in collaboration with other professionals. The focus of the behavioral therapy is to support the child while gradually exposing them to more challenging speaking tasks. One of the most effective behavioral strategies for children with SM is called stimulus fading. So this method involves the child gradually increasing their ability to communicate as new people, settings, or demands are introduced very slowly and systematically while keeping the anxiety low. So the child begins speaking in a situation where they already feel safe, and changes are made one small step at a time so that they can maintain success. The personalized hierarchy of exposure will be generated based on the specific child, but it may begin with the child speaking to their caregiver in a private room at the school. Then the teacher may be present but not participate in the conversation. Over time, they may progress to speaking in front of a peer, then with a peer, and so on, with the eventual goal of communicating effectively and with low anxiety across conversation partners, settings, and activities. Another effective behavioral strategy commonly used is called shaping. This method aims to encourage and reward all forms of communication until the desired form is accomplished. It should be noted, however, that having an overly excited or exaggerated reaction when the child does speak may contribute to feelings of being put on the spot or feed into the child's perception that them speaking is a very big deal. So we want to reinforce calmly and focus the positivity on the bravery and not the speech itself. Cognitive behavioral therapy is a well-documented and effective method used across many mental health disorders. It is based in identifying anxious thoughts, in this case related to speaking situations, and learning to replace them with more happy, healthy, and realistic ones, with the goal being to identify moments of anxiety and implement coping strategies to work through it instead of relying on avoidance behaviors. This is typically best for older children who are able to reflect on and restructure their thoughts and better monitor their own anxiety. Medication can be considered, but it is typically only recommended when well-implemented behavioral therapy has led to little improvement, the disorder is severe and persistent, and the child is a little bit older. So you may have students in your classroom who use AAC, or Augmentative and Alternative Communication. AAC can be incorporated into treatment, but it is not meant to be a permanent solution and is typically faded out over time. And the reason why SLPs are hesitant to provide the child with AAC is because therapy is based in exposure. So if they are able to easily avoid speaking by using another method, they may use this as an escape strategy and backslide in progress. With this said, it is very important that within the classroom, the child has a functional way to communicate their day-to-day needs. So here you'll see an example of a communication board that includes some important messages such as I need help, stop, and bathroom. And just as with all AAC tools, this board should be accessible to the child at all times in the same way that other children always have access to their speaking voices. Before moving into specific strategies that you can use when interacting with children with SM, I wanted to mention what is called the Universal Design for Learning, or UDL. This is an educational framework that aims to design learning environments that are accessible, flexible, and inclusive for all learners from the start, rather than making accommodations after barriers appear. Learners may vary widely in how they engage, process, and express what they know. We should aim to cater to all students. This can be accomplished by encouraging and accepting multiple means of representation, action and expression, and engagement. So the means of representation is the how of learning. By providing multiple ways for the child to access information, they're more likely to understand it. Multiple means of action and expression is the what of learning. So by providing different ways for students to demonstrate their learning, children who are not comfortable speaking, for example, can still have the opportunity to display their learning in other ways. Allowing multiple means of engagement, or the why of learning, allows children to participate in different ways and in a way that is comfortable for each student. So this is a helpful mindset for facilitating an inclusive classroom for all children, including those with situational mutism. So now, here are some ways that you as educators can promote positive interactions and facilitating context for a child with SM to communicate. The first list of strategies focuses on reducing anxiety for the child to help them feel safe. You should never force verbal communication. Try to be accepting of all forms of communication. Allow a warm-up time for the child to be comfortable, especially before more demanding situations. When working with a child, try sitting beside them as opposed to across from them. This can help them feel less perceived, and it also minimizes the need for eye contact, which can be difficult for children with SM. Ensure that the child has a way to communicate their basic needs, as we discussed. Maintain a calm and friendly demeanor. Allow for extra time when asking the child to respond, ideally at least 5 seconds. Patience is key. You can arrange one-on-one opportunities for the child to communicate with you if they are not yet comfortable speaking in front of others or larger groups. Try to maintain a classroom routine so that the child can depend on a familiar schedule and avoid feeling flustered by any unexpected events. Try to find non-speaking tasks that the child can complete successfully to boost their confidence and independence. Lastly, establish an inclusive, safe classroom and advocate for the student when needed. You can also use strategies to modify your own communication to communicate more effectively with the child. You can try reflecting back the child's communication to show them that you understand and that their message, however they're getting it out, is valuable. Avoid speaking for the child, as this can reinforce escape tendencies or lead to frustration if their intentions are being misinterpreted. In the beginning stages, avoid questions. Instead, stick to commentary on activities that they enjoy. Once they become more comfortable, try using yes-no questions that they can respond to non-verbally. After this, you can progress to forced choice questions. These typically elicit one-word responses. For example, do you want the blue crayon or the red crayon? This will be much easier for the child to respond to compared to open-ended questions. Avoid using the words talk and speak, and instead use words like words and voice, as the child may have a negative connotation with certain words. Continue the conversation regardless of whether the child is participating verbally. This shows them that you value them as a person and a student, whether they are willing to speak in that moment or not. Provide specific praise to reinforce desired behaviors when interacting, and try to use low pressure and neutral language. For example, you can answer this however you would like. It may take some time and practice to master all of these strategies, and that is okay. As long as you are trying your best to support the child and making an effort to make them feel safe and communicate with them effectively, it is a meaningful step forward. I understand that I have provided you with a lot of information and you may feel a little bit overwhelmed. But if you want to learn more about situational mutism, or just have the chance to review some of the many concepts that we've talked about today, here are 2 reading options. Overcoming Selective Mutism comes highly recommended by psychologists in the field as a helpful resource not only for parents, but also for educators and other professionals as well. This book offers actionable strategies and expert advice for parents, teachers, and therapists working with children who have SM. It includes research-backed techniques, personal stories, and practical tips to create a supportive environment that encourages communication. The Selective Mutism Association has a 28-page resource on their website dedicated to providing educators with tools to help them support children with SM. Some of these strategies have been discussed today, but for a deeper dive, check out this helpful resource catered specifically for teachers such as yourselves. There are also many websites that you can use as resources to further your knowledge of situational mutism. The Child Mind Institute offers an accessible teacher guide explaining what SM looks like at school, how to identify the signs, and classroom-friendly strategies to help children communicate and feel safe. The American Speech Language Hearing Association, or ASHA, has tons of information about SM on their website. They dive deeper into the assessment and treatment if you're curious to learn more about that. The Strive to Speak website is a great resource for parents and teachers that offers a long list of children's books specifically about situational mutism, along with links to purchase them. These books may be helpful to read to the whole classroom to help other students understand why one of the classmates doesn't speak. The SMHELP, or Home Educational Learning Program, offers many resources, trainings, as well as free online summits. If you prefer watching videos, here are 2 fantastic YouTube channels with videos all about situational mutism. The Selective Mutism Association has many video resources. You could spend a whole day on this channel and still have much more to learn. And one of their playlists is called Kid to Kid Tips, which I really liked. This features children with situational mutism sharing their advice on what worked for them in situations like starting a new school, ordering takeout, trying to make new friends. And on the right, Anna Biavati, a speech-language pathologist, has a channel called Selective Mutism and the Brave Muscle Method, and this is dedicated to teaching others about situational mutism. There are hundreds of videos, some made directly for children with SM to help them find what she calls their brave voice, and some for parents and educators that offer tools and strategies to help create safe environments for children to speak. And lastly, if you are a podcast lover, here are some helpful and evidence-based resources for easy listening on your way to work. Unspoken Words is a channel that currently has 65 episodes talking about everything SM related. It includes some more niche topics such as sensory challenges, helping to foster independence, and considerations for use of medication. Along with this, there are many episodes that feature individuals that overcame situational mutism, and you can hear their firsthand lived experiences with this disorder. Thank you so much for listening. I really hope that you've learned something new during this presentation and that you are leaving with a clear understanding of how you can best support children with situational mutism. Should you have any questions now or in the future, please do not hesitate to reach out.